Incident reporting. As a home care worker, you are expected to report any injury or incident that occurs while you are caring for your consumer. An incident is any situation or occurrence that is out of the ordinary or unexpected, or has the potential to cause harm to your consumer or to you.
Incident reporting is a mechanism of tracking and course of care for a patient, family, or an employee. If there is an injury in the home, such as a fall, if there is something missed, a medication, whether the patient refuses it or whether they miss taking it, if there is an injury to an employee, whether it be due to them falling themselves, weather conditions, we report these incidents both to the state or to our internal facilities, depending on how your facility is owned. That way we can determine if we need to re-educate staff, re-educate patients. How can we improve our agencies to prevent further falls, prevent further medication errors? It's very, very important for that course of care for that patient.
Sometimes it may be hard to determine what should be reported, but when in doubt, report it.
Absolutely. Always err on the side of safety. Always err on the side of reporting and communicating. You never want to be in a position where you say, I wish I would have.
I always tell the staff that there is never anything that you can't report. Always, if you feel uneasy about it, call someone and tell them. In most caregiver cases, we have somebody on call 24 hours. There's someone that you can call and say, hey, this happened, I don't know what to do, and they will help you. You know, if you're fairly new and you're unsure of what's happening, and maybe, you know, Martha, your consumer, is not feeling well that day and she kind of has a little fever and, you know, she's just seems achy and things. It might be the flu, but, you know, it's still okay to call and let someone know, because if you don't know Martha very well, then, you know, chances are you're not going to know all of her situations. Maybe she has a medical condition that those are the early signs of something, and there will be somebody who knows what to do.
I had a consumer fall, and basically she didn't fall hard or anything. She actually kind of went real slow and ended up on her bottom, and I asked her if she was okay. I asked her if anything hurt. She said no, kind of assessed the situation, felt around, she was okay. I got her up, and after she seemed to be fine and I took her vitals, then I reported it. It was still within the 60 minutes, and at that time she was fine. There was no issues.
Incident reporting protects you and protects the agency, even if it's an incident that happened before you got there. Even if it's something you didn't see, if your intuition tells you to report it, do it. For example, let's say you see bruises on your client that were not there the last time. It could be from abuse in the home, or perhaps your consumer fell. You decide not to report it, your consumer ends up in the hospital the next day, and the family accuses you of abuse. This is rare, but it can happen. So when in doubt, report.
That caregiver may not know what to do with that information because they didn't see it themselves. They just suspect it, or they've heard rumblings of it, or things like that. And again, it goes back to the communication from that caregiver to the agency of, when in doubt, get the information up the chain and let other people, you know, let your supervisors and your AAA and the case managers look into it and really dig in and see if there's something there.
Here is a list of events that should be reported as required by the State Health Department. Any complaints of your consumer being abused, whether it is confirmed or not. Any injury or accident. Any medication errors or adverse drug reactions. Patient elopement. The patient leaves without you or their family knowing about it. Any falls with unanticipated injury requiring healthcare services. Any health department reportable diseases. Any interruption of any service in the home that can compromise the safety of your consumer, such as utilities being shut off. Any disruption of service due to disaster, such as fire, storm, flood, or other occurrence. Any type of consumer neglect. a transfer or admission to a hospital because of injury or accident, any unlicensed practice of a regulated professional, any misappropriation of the consumer's property, any death, serious injury, or hospitalization, any physical, psychological, or sexual abuse.
They should report all incidences. I'd rather know about all of them if they're in a gray area, especially things like the patient's refusing to take a medication. Yes, that is a patient's choice. However, because we might be doing things that involve that particular medication, we need to know about them. If there's a fall, even if the patient was not injured, they got themselves back up, everything is fine, we need to know about it, because eventually, if the patient has numerous falls, maybe we need to add a therapist to the home. Maybe we need to re-educate. You know, do we need to pull up throw rugs in their house? Do we need to move things around in their home so that there's not the potential for injury to that patient?
Anything odd that happens within a patient's home or to the patient. The patient develops a wound that was not anticipated. Their cast on their leg is too tight and has to be cut off because it's cutting the circulation off. We would do an incident report on that.
And so I think that communicating to the direct care workers to, if there's any doubt, report. Let the office know, let your nursing supervisor know, and then let the nursing supervisor decide whether that's something that actually officially needs to be reported to the state, or if it's something that just needs to be communicated to the family or a physician or something like that. But to the direct care worker, I think the key is that they know that patient, they know that client better than anybody else, sometimes even better than the family. And so when they see something is off, report it. You know, be the eyes and ears, get the information up the chain to your team, and let them decide if that's something that needs to be reported to the different state agencies.
You may know your consumer better than almost anyone. If you notice any marked change in behavior or any change in their medical condition that is worsening, report it. There are also many incidents that may occur that affect you, the home care worker, that should also be reported. If you injure yourself on the job, if you have an accidental exposure to infected material, if you have an accident when transferring your client that results in a fall, report this whether you or the consumer notices any injury, any accidents in the home or car while you are on duty, a verbal confrontation with your consumer or consumer's family members, if your consumer accuses you of something that you have not done. Sometimes this can be an early indicator of dementia. Regardless, it needs to be documented.
Documentation is huge, especially in the home setting. We're scrutinized pretty heavily with anything that we do. If it's not documented, it was not done. If it's not documented, it did not happen. So even in the aides, when they do their documentation, if even a family member told them something occurred, whether or not they actually saw it, they need to report it to the nurse in charge of the care or the therapist or a central person who might be in charge. In my agency, that is me.
Say the refrigerator was leaking, or maybe the washing machine was making a noise. That's something that's not gonna hurt anybody, and that's fine to make a little note and let the team leader know the next day, or even call into the office the next day, just make a little note.
When in doubt, report. And I think there's different filters, so to speak, is that the caregiver has that intuition. They know that Mrs. Smith just isn't looking right, and maybe there's a UTI or there's something that they can catch early. But the next level of filter is your management and your supervision and your nursing staff. And while they might not be passing on every report to the state, they at least are getting as much information from the front lines as possible.
Clover Reefstall was at a consumer's home one day when her intuition told her something was wrong. She explains.
Well, I had a consumer once, and she was diabetic, and she was sitting at the table. I was getting lunch for everybody, and her son just happened to come in from out of state. He was visiting, sitting directly across from her, almost like you and I here together. And I was getting lunch, and I turned around, and she had started to go kind of white. But she wasn't really, like, you didn't look at her and say, gosh, Her son's visiting, talking with her, and I'm like, are you feeling okay? And she's eating. Yeah, I'm okay. And I said, well, you don't look quite yourself. You just don't look, just 100%. And I'm like, humor me. She was diabetic, so I took her blood sugar, and it was 60, which is way, way too low. And she's eating. And by then she had begun to sweat, you know, and it was like, it could have been an emergency. It just was one of those things where that intuition, you just knew something wasn't quite right. And we were able to catch her before she actually went into shock or something. And her son said, I didn't even realize it, didn't even know it.
Clover immediately gave her some juice, and her blood sugar went back to normal. While this may seem like a very minor incident, she reported it that day.
I guess maybe one of the best examples I could give would be a diabetic patient that their dog jumped on them and scratched their leg. Minor, it seems like a nothing, but diabetics don't heal the same way that someone who is non-diabetic would. That could turn into something pretty severe for that diabetic who maybe doesn't have the same sensation and certainly doesn't have the same blood flow or healing capacity as someone else. We don't want that to turn into a major wound, infection, or severeness to that lower leg when we could have prevented that by taking a look at it immediately. Anybody can ask for records on the patient at any time, whether it be the insurance company, the fiscal intermediary, CMS, the state themselves, the Department of Health, they monitor as well. And then, say there's an attorney involved, or family members can request records on their loved ones. So we really, really need to make sure that anything that happens, anything that's reported to us, to the aides especially, that they make sure somebody knows about it. And incident reporting is a good way for them to make sure that someone knows.
Just trust your instincts. I'd rather have 10 reports and not need them than not have a report that I did need.